Inflammatory bowel disease, or IBD, is a chronic condition that affects millions of people worldwide. It can cause a range of symptoms, from abdominal pain and diarrhea to rectal bleeding and fatigue, and can significantly impact a person's quality of life. Understanding IBD and its two main types, Crohn's disease and ulcerative colitis, is essential for those who have been diagnosed with the condition, as well as for their loved ones and caregivers. In this video, we will provide you with 10 helpful pieces of information about IBD and its types, including their symptoms, causes, and treatment options. We'll also discuss some of the challenges that people with IBD may face and offer tips for managing the condition effectively. Whether you have IBD yourself, know someone who does, or are simply interested in learning more about this complex condition, we hope that this video will provide you with valuable insights and help you to better understand the impact of IBD on those who live with it. 1. Inflammatory bowel disease, or IBD, is a chronic condition that affects the digestive tract, including the stomach, intestines, and colon. It is caused by an abnormal immune response that leads to chronic inflammation and damage to the lining of the digestive tract. The two main types of IBD are Crohn's disease and ulcerative colitis, both of which can cause a range of symptoms, including abdominal pain, diarrhea, and fatigue. While there is no cure for IBD, treatment options can help manage symptoms and reduce inflammation, allowing people with the condition to lead full and active lives. 2. Crohn's disease and ulcerative colitis are the two main types of inflammatory bowel disease, IBD, and although they share some similarities, they affect different parts of the digestive tract and have distinct symptoms. Crohn's disease can affect any part of the digestive tract from the mouth to the anus, but most commonly affects the end of the small intestine and the beginning of the large intestine. Symptoms can include abdominal pain, diarrhea, weight loss, and fatigue. On the other hand, ulcerative colitis affects only the colon and rectum, causing inflammation and sores on the lining of the colon. Symptoms can include diarrhea, abdominal pain, and rectal bleeding. It's important for individuals with IBD to work closely with their healthcare team to properly diagnose and manage their condition, as treatment options can vary depending on the type and severity of the disease. 3. Crohn's disease is a chronic inflammatory condition that can affect any part of the digestive tract, from the mouth to the anus. However, it most commonly affects the end of the small intestine, ileum, and the beginning of the large intestine, colon. The symptoms of Crohn's disease can vary from person to person, but some of the most common ones include abdominal pain and cramping, diarrhea, weight loss, fatigue, and fever. Other symptoms can include reduced appetite, nausea, and vomiting. Crohn's disease is a chronic condition, which means that it can last for many years or even a lifetime. While there is no cure for Crohn's disease, there are treatments that can help manage the symptoms and reduce inflammation in the digestive tract. It's important for individuals with Crohn's disease to work closely with their healthcare team to develop a personalized treatment plan that takes into account the severity of the disease, its location in the digestive tract, and other factors. 4. Ulcerative colitis is a type of inflammatory bowel disease, IBD, that affects only the colon, large intestine, and the rectum. It causes chronic inflammation and sores, ulcers, to form on the lining of the colon and rectum. The symptoms of ulcerative colitis can vary in severity and may include diarrhea, abdominal pain, rectal bleeding, and a frequent urge to have a bowel movement. Other symptoms can include weight loss, fatigue, and fever. Like Crohn's disease, there is no cure for ulcerative colitis, but there are treatments available that can help manage the symptoms and reduce inflammation in the colon. These treatments can include medications, dietary changes, and in some cases, surgery. It's important for individuals with ulcerative colitis to work closely with their healthcare team to develop a personalized treatment plan that takes into account the severity of the disease, the location of the inflammation in the colon, and other factors. With the right treatment, many people with ulcerative colitis are able to manage their symptoms effectively and lead full and active lives. 5. The exact cause of IBD is unknown, but it is believed to involve a combination of genetic, environmental, and immune system factors. While the exact cause of inflammatory bowel disease, IBD, is unknown, it is believed to involve a combination of genetic, environmental, and immune system factors. Research has shown that people with a family history of IBD are more likely to develop the condition themselves, indicating that there may be a genetic component to the disease. However, genetics alone do not explain why some people develop IBD and others do not. Environmental factors, such as diet, stress, and exposure to certain bacteria or viruses, may also play a role in the development of IBD. For example, studies have suggested that a diet high in fat or refined sugar may increase the risk of developing IBD. Finally, IBD is thought to be an autoimmune disorder, which means that the immune system mistakenly attacks the body's own tissues, leading to chronic inflammation in the digestive tract. While the exact cause of IBD is not fully understood, ongoing research is helping to shed light on the complex factors that contribute to the development and progression of the disease. 6. There is no cure for IBD, but treatment options can help manage symptoms and reduce inflammation. These can include medications, dietary changes, and surgery in severe cases. While there is currently no cure for inflammatory bowel disease, IBD, there are a variety of treatment options available that can help manage symptoms and reduce inflammation in the digestive tract. Medications are often the first line of treatment for IBD, and there are several different types of drugs that can be used depending on the severity of the disease and the location of the inflammation. These may include anti-inflammatory drugs, immune system suppressors, and antibiotics. In addition to medication, dietary changes can also be an important part of managing IBD symptoms. Some people with IBD find that certain foods or beverages can trigger symptoms, so they may need to avoid these or modify their diet in other ways. A registered dietitian can provide guidance on how to make dietary changes that can help manage IBD symptoms. In severe cases of IBD that do not respond to medication or dietary changes, surgery may be necessary. Surgery for IBD can involve removing a portion of the intestine or rectum, or creating a temporary or permanent ostomy. It's important for individuals with IBD to work closely with their healthcare team to develop a personalized treatment plan that takes into account the severity of the disease, its location in the digestive tract, and other factors. With the right treatment, many people with IBD are able to manage their symptoms effectively and lead full and active lives. 7. For individuals with inflammatory bowel disease, IBD, it's important to work closely with a healthcare team that includes a gastroenterologist and a registered dietitian to manage their condition. A gastroenterologist is a doctor who specializes in the diagnosis and treatment of digestive diseases, including IBD. They can work with patients to develop a personalized treatment plan that may include medication, dietary changes, and other therapies. A registered dietitian can also play an important role in managing IBD, as some people with the condition find that certain foods or beverages can trigger symptoms. A dietitian can provide guidance on how to make dietary changes that can help manage IBD symptoms while ensuring that patients are getting the nutrients they need to stay healthy. In addition to a gastroenterologist and a registered dietitian, an IBD healthcare team may also include a primary care physician, a nurse practitioner, a mental health professional, and other specialists as needed. By working closely with a healthcare team, individuals with IBD can ensure that they are receiving comprehensive care that addresses their unique needs and helps them manage their symptoms effectively. 8. Stress and anxiety can exacerbate symptoms of inflammatory bowel disease, IBD, so it's important for individuals with IBD to prioritize self-care and stress management techniques as part of their overall treatment plan. Stress can trigger symptoms such as abdominal pain, diarrhea, and fatigue in individuals with IBD, and research has shown that stress reduction techniques can help reduce inflammation in the digestive tract. There are a variety of stress management techniques that can be helpful for individuals with IBD, including mindfulness meditation, deep breathing exercises, yoga, and progressive muscle relaxation. Regular exercise can also be a great way to reduce stress and improve overall health. In addition to stress management techniques, it's important for individuals with IBD to prioritize self-care in other ways, such as getting enough sleep, staying hydrated, and avoiding smoking and excessive alcohol consumption. By taking a holistic approach to managing their condition that includes stress reduction and self-care, individuals with IBD can improve their quality of life and reduce the frequency and severity of their symptoms. 9. Individuals with inflammatory bowel disease, IBD, may be at increased risk for other health conditions, such as osteoporosis, anemia, and colon cancer, due to the chronic inflammation and damage to the digestive tract that occurs with the condition. Regular monitoring and screening can help detect and manage these risks. For example, individuals with IBD may need to have regular bone density tests to monitor for osteoporosis, a condition in which bones become weak and brittle. They may also need to have regular blood tests to monitor for anemia, a condition in which the body does not have enough red blood cells to carry oxygen to the body's tissues. In addition, individuals with IBD may be at increased risk for colon cancer, especially if they have had the condition for many years or if their condition affects a large portion of the colon. Regular colonoscopies and other screening tests can help detect any early signs of colon cancer and allow for early treatment. By working closely with their healthcare team and staying up to date on recommended monitoring and screening tests, individuals with IBD can help manage their condition and reduce their risk of developing other health complications. In conclusion, IBD is a challenging condition, but with the right treatment and management strategies, it is possible to live a full and active life. We encourage those who have been diagnosed with IBD to work closely with their healthcare team to develop a personalized treatment plan and to prioritize self-care and stress management techniques. If you found this video helpful, please like, share, and subscribe to our channel for more informative content. And as always, we welcome your comments and questions, so please feel free to leave them below. Thank you for watching, and we'll see you in the next video.